So the PROfound study was really a follow-up to the TOPARP study that had been done that established proof of concept that patients with metastatic prostate cancer with tumors harboring alterations in homologous repair genes were sensitive to treatment with PARP inhibition. So this was a randomized phase 3 study, enrolled patients with castration-resistant metastatic prostate cancer who had received either abiraterone or enzalutamide. And the randomization was to the other next generation hormonal treatment that the patient had received versus PARP inhibition. There were two cohorts. One cohort enrolled patients with BRCA or ATM mutations. Those are a little bit more common, and the initial data suggested maybe a little bit more sensitivity with PARP inhibition in those patient populations. And then the other cohort included 12 other genes that might be altered in the DNA response and repair pathway. And the PROfound study showed in the initial publication that treatment with a PARP inhibitor in these populations led to a significant improvement in progression-free survival compared to the other next-generation hormonal therapy. And recently at ESMO, we've heard with more mature follow-up that there's an overall survival benefit too, at least in the cohort with BRCA and ATM mutations. This result is practice-changing. We have really elegant development of PARP inhibition in the treatment of metastatic prostate cancer with early studies demonstrating proof of concept really in the population that you would expect to benefit the most. And now randomized data showing clinical benefit when patients are randomized to an alternative treatment strategy and showing an overall survival benefit despite the fact that there was a relatively high level of crossover. And so this is a treatment strategy that really should be considered in patients with metastatic prostate cancer, as should genomic testing to determine if patients harbor these alterations to allow this to be discussed as a potential treatment strategy.